There was a Gallup study back in 2022 that said only 32% of employees are thriving in overall well-being.
True health should be evaluated in more of a holistic approach, recognizing that mental health, spiritual health, financial health, sexual health, emotional health are all important to well-being. We've seen a lot post-COVID, individuals who did work from home had actual increased productivity compared to when they were working in the office. They had less stress, they were less quote unquote sick days because they were able to do multiple things at one time.
I want to double click on that. So with the move to, remote work, what are some of the things you're seeing from a mental health standpoint that employees are struggling with, from a remote setting standpoint?
I will say that there are a few studies that are coming out that actually promote hybrid work. You can get the best of both worlds. A lot of organizations are saying, okay, you have to be in the office maybe 2 days out of the 5 days, improve social engagement. And then also you have the opportunity to spend maybe the next 2 to 3 days at home where you can have the ease and the quote unquote luxury of being remote.
Yeah, I totally agree with that as well. I mean, we are looking at more kind of quarterly meetings where we get together in person. We have a team that's all over the country, some places across the world. We had one of our first meetings last year and it was like, oh, wow, I thought everyone's taller than they normally were, right? Because so used to seeing them on the screen. Hello, everyone. Welcome once again to Medical Practice Success Secrets. I'm your host, Theo Harvey. And once again, we have another special guest with us, Dr. Ampadu. How are you today?
I'm doing great. Thanks for asking, Mr. Harvey, and thank you for having me here. It's just a great opportunity, and I'm excited for this conversation we're about to have.
Wonderful, wonderful. Well, if you don't know Dr. Ampadu, she is a board certified internal medicine trained hospitalist, physician who is passionate about providing quality inpatient adult care. Outside of taking care of patients on the hospital ward, she has a passion for harnessing the power of innovative solutions to ensure health equity and equal access to quality healthcare for all. She's an expert in corporate well-being, helping organizations promote and improve the holistic health of the employees. So we had the wonderful chance to connect with her on social media. And one of the things that comes up more and more as we're kind of looking at the data, there was a Gallup study back in 2022 that said only 32% of employees are thriving in overall well-being. As a leader in workplace wellness, how do you envision the future of healthcare evolving to better support professionals?
Great question. So, for many years, healthcare has kind of looked towards, I guess, the allopathic ways to help patients. It's been mostly focused on disease treatment and a bit of disease prevention. But I think right now, especially post-COVID, we're recognizing that true health should be evaluated in more of a holistic approach, recognizing that mental health, spiritual health, financial health, sexual health, emotional health are all important to well-being. So I think that right now, healthcare is evolving to incorporate the other aspects of health to really give a holistic approach to how we can improve an adult's well-being. In the past, occupational health, which is a specialty which kind of focuses on workplace well-being, they were largely focused on like environmental hazards. So like noise pollution, construction sites, asbestos, fumes, then we kind of started going into ergonomics, right? Making sure that the individuals who are in the office, they have quality desk setups, they have good chairs to sit on, keyboards and things of that nature. And but now we recognize that there's also another aspect, which is the mental health aspect of work. We've seen a lot that post-COVID, individuals who did work from home had actual increased productivity compared to when they were working in the office. They had less stress, they were less quote unquote sick days because they were able to do multiple things at one time. So I think right now, healthcare is really looking to find ways to support professionals from a mental aspect to make your job enjoyable as well as make it safe and healthy for you.
I love that. And, I actually have a standing desk as we're talking. I lift it up every day when I need to stand up and do meetings and things like that instead of sitting down. I think that is something that as a corporate wellness professional, that sitting down is something you don't want to do as much. You want to stand around, move around more. So yeah, so that's something that I started to do and incorporate, and it did come out of the pandemic. Sitting for hours on Zoom calls and meetings. I wanted to double click on that. So with the move to remote work and all that, what are some of the things you're seeing from a mental health standpoint that employees are struggling with, from a remote setting standpoint, and I can tell you from experience, we've hired younger professionals who kind of want the more in-person environment because they feel like they're connected more to people and want to have conversations and feel like they're in a workplace environment. Whereas older professionals who have kids like myself, they're like, hey, remote setting is fine. I can do my work and do the time with my kids. Are you seeing that bifurcation between younger and older professionals? And then what mental things are you seeing that people struggle with from remote work?
Yeah, so it's so interesting that you're saying that there's really like been a shift and a split, which is absolutely correct. The younger individuals are looking more into social connections because that is something that can be lost when you're doing work from home, unless you are intentional about leaving your job at 5 o'clock, making sure you go to, I don't know, a happy hour or seeing your friends or your family, where you have the older individuals who they've got kids. Now they can, pick up little Timmy from school at 2 o'clock rather than having to go and pay a babysitter to go pick up little Timmy. They can also go to these type of events. So you're absolutely right. There is kind of differences in people's opinion on whether or not work from home is beneficial. I will say that there are a few studies that are coming out that actually promote hybrid work, where you can get the best of both worlds. A lot of organizations are saying, okay, you have to be in the office maybe 2 days out of the 5 days. That also helps their real estate, as we know, because they had tons of empty office buildings that were not being inhabited, and they had to spend a lot of money on real estate. But helping people to come into the office maybe 2 or 3 times a week, improve social engagement. There's a lot of things that can be done face to face that's easier than, say, remote. And then also you have the opportunity to spend maybe the next 2 to 3 days at home, where you can have the ease and the quote unquote luxury of being remote. So right now, I think a lot of companies, unless you're being mandated to return to work, a lot of them are actually looking at the hybrid models, which seem to improve employee happiness and really foster a healthy work environment.
Yeah, I totally agree with that as well. I mean, we are looking at more kind of quarterly meetings where we get together in person. We have a team that's all over the country, even some places across the world. And so having, these quarterly meetings to kind of meet each other in person, like we had one of our first meetings last year and it was like, oh, wow, I thought everyone's taller than they normally were, right? Because so used to seeing them on the screen. And so I said, oh, wow, we're all about, little shorties. So it was kind of interesting to kind of see that, dynamic. And likewise, you're right. As a parent of, growing children, a 9-year old and a 13-year old, they also have, sports programs now and after school programs. And so I literally today I have a game that I go to my son's at 4 o'clock. Right. So I was working in the office. I had to get through traffic and leave and all that stuff and talk to my boss. But no, I'm going straight to his game after a couple of meetings. So stuff like that is so important. So I agree. I think having that hybrid kind of work environment is key to kind of balance both. To your point, when you kind of look at some more other data that we saw around this space, Pew Research Center found that over 70% of adults turn to digital platforms for health information. Obviously, that exacerbated during COVID. As both a physician and media consultant, how can we responsibly use media to bridge the gap between healthcare and public understanding?
Yeah, we have so many platforms now, whether it's a video platform, whether it's audio platform, even LinkedIn has even gotten to the game, really heavy into the game as well. It was, previously known as a professional website to look for jobs, and now people are also providing input there. I think the number one thing that we have to recognize is that we need to adhere to HIPAA laws, no matter what kind of outlet that you use. We need to respect patient privacy and confidentiality and autonomy. I think that if we're not careful, even using a patient or a client story, and not appropriately removing the identifiers runs the risk of exposing someone's, personal health issues. So we have to be very, very modest and very, very adhere to those rules. I would say now social media has also given several people a voice. The stay-at-home mom has a voice. The 96-year-old war vet has a voice. The little 7-year-old playing video games has a voice, right? Everybody has a voice on social media. So it's also very important to really highlight content from well-versed and vetted sources, whether it's a dietitian, whether it's a mental health counselor, whether it's a physician, whoever it may be. It's crucial to make sure that this person knows what they're talking about, and they have kind of either the skills, the experience, or the credentials to back it up, because there are a lot of people out there that are claiming to, be able to fix this issue. We can fix your blood pressure with this, that, and the other, all natural. You don't need medications. And a lot of individuals are falling in by the wayside and are it's doing more harm than good. So definitely it's important to highlight content from vetted sources, credible sources that for sure they know what they're talking about, and there is science and evidence-based input behind what they're saying. I would also say social media, you have individuals from all different backgrounds, different educational levels. So if you're going to be using social media to give health-related content, use clear and understandable language that is understandable across all education and reading levels. It's very important. Sometimes you start using these big medical terms and then you've lost your audience. Sometimes even me, sometimes some of these words I don't even understand, and I have to look it up. So make sure that you can say something that people will understand, and ask the public what they want. A lot of times you may think you know what is important for individuals to know about health or about themselves, but we can ask the public. Do a quick survey, do a email. Send a Instagram. Just ask your audience, what do you want to hear from me? What do you want to hear from healthcare professionals? And they'll tell you, and then you can tailor your content to that.
Wow, you hit on a lot of things there. I mean, obviously we saw the rise of misinformation rise during COVID on social media, and it was so imperative that professionals like yourself get on social media to correct the case. So I look at interviews we've done before with Dr. Jane Morgan, who did a steroid series where she sat on a stairway and talked about COVID, and she's a cardiologist and giving advice on that. Or we did an interview with Dr. Refi, who's a pulmonologist, and he gave examples on TikTok on how to breathe, and if you're suffering from breathing conditions, how you can resolve with that. And then we also had a recent one with Dr. Durag, who uses rap to educate patients, right, on how to take care and providing medical education from evidence-backed studies, but in a different format. So when you kind of look at these examples and yourself as well, educating the populace on mental health and wellness in a corporate setting, what advice are you giving, some of the professionals who are looking for like, hey, I want to get on social media. I know it's important to be out there. What are some of the things that you're telling them to do to kind of get started in this process? Because we need more folks like you out there.
Yeah, definitely. People tend to reach out to me to ask, I see what you're doing on social media. How do I get get in on it or whatever? And I honestly, I tell them, do what you like. If you like to write, then write a blog post, or write some information on the 5 ways to get more fiber into your diet, something like that. If you like to talk, you consider short form videos, webinars, podcasts like this. If you like to do kind of face to face engagement, consider maybe not just social media, but consider just community involvement. See how you can really touch individuals and touch patients, not just in a hospital or a clinic setting. Maybe there's some type of local fair, any type of community engagement, you know. So I tell people, just because other people are doing something doesn't necessarily mean that that's your avenue or that's your path. I would really focus on what you like to do, what you enjoy doing, and what you're good at. Also, I think doing research on the most common health trends, the current trends, so that you can also have an understanding on what people want to hear. Also, just having basic research on social media. You know, now we know people have very short attention spans. Maybe your video doesn't need to be 60 minutes because nobody's going to listen to you after 27 minutes. Maybe, maybe make sure that you understand how to garner attention, gain attention, and keep your audience engaged. And I would say the last thing would be, don't do it alone. You know, collaboration is key. If you have other individuals that you can speak with, that you can work with, that you can do a podcast like this one with, it helps to really amplify your message and get it to more audience members.
I love that. So, obviously consider the format you best at: written form, verbal form, video form, partner with the right individuals and doing, things like this, cross collaborate. I think that's so important. We're big in that as well. Those are great ideas. I was just thinking also of Dr. Isan, who's a cardiologist, and he talked about reason why he got on social media is because he was getting the same questions over and over again. So he said, well, let me just put it out there. So yes, my patients are asking these questions, but in a city, in a state. He said, well, what if I, expand it out and then more people have the same questions and it can help them? I think intentionality is a key. If you go in it with, I'm trying to help people, yes, social media can be a little interesting with comments and people, questioning things. But if you go in there with the right frame of reference and mindset and intentionality, I think you're coming out on the other end because you're out there to help people. And I think people sense that, the authenticity that you bring to it. So, no, this is great. Thank you for that information. I mean, technology, our wheelhouse, we do like remote patient monitoring. We help patients and doctors connect with cellular connected devices, but also with apps to keep patients engaged. I mean, what are your thoughts about technology and where it's going, especially around remote care programs, telehealth, and even the advent of AI, artificial intelligence? How can that help, individuals in corporate wellness environment or just in general? What are your thoughts as a healthcare professional?
AI is here to stay. ChatGPT is here to stay. Before, a lot of people were against it, but we have to embrace it and recognize that if if we do the right thing, it can be more advantageous than hurtful. I think when it comes to, say, employee health, corporate wellness, data is key. And I think that using remote monitoring from an employee standpoint is actually going to hopefully improve corporate culture and an environmental culture. Say for instance, a human resource or workplace wellness department can use the data from maybe a simple app that they give their employees. Throughout the day, you just press from 1 to 5, how is your stress level right now, or is the project you're working on right now making you happy or more stressful? Then they can collect that data and then use that to figure out what they need to do as an organization to improve kind of the mental health of their employees. So I think that is definitely crucial. Even when you think of employees that may have, say, chronic health conditions, trying to help them to manage their chronic conditions, whether it's blood sugar monitoring, blood pressure monitoring, somebody with congestive heart failure monitoring, their weight gain, their weight loss when they take their medications, and maybe connecting that with health resources that are within the company or maybe their doctor. That could probably reduce sick days. That could probably reduce call outs. So again, I think that using remote patient monitoring to collect data and using that to support the employees will definitely, in the long term, likely help the bottom line of these organizations.
Yeah, I agree. I mean, artificial intelligence is here. I have a video where I talked about the details of what's happening with it. It's moving so fast. And so it's hard to get a grasp of it. So, we went from, these what they call large language models where you're actually getting information feedback, creating these stories. But the challenge with AI you can recognize this as a scientific professional. It can do something called, make up lies, right?
Yeah,
And so
yeah.
it's not really thinking; it's just predicting what the internet is told it or taught it to say, and it may be incorrect. And so we need professionals, in the front line that can gather the data and say, no, this is incorrect. It needs to change like this to make sure it's correct. So brings back the answer with so much speed that we think is accurate. But just because something is speedy doesn't mean it's true. And so I think a lot of times, people have to realize that AI is a great tool. All these tools are great, but they're tools, and they still need that human interaction and a validation before you kind of release it out into the wild. And also, there have been talks about replacing healthcare professionals, right, with some of these tools. And I think, we're still a long way off. Some cases, where they're able to predict, looking at radiology images and can predict certain things from that. I think that's valid and a good way to look at it, but not making, life or death decisions, clinical decisions for patients. Hopefully, the technologists will slow that down a little bit and have more input from the healthcare professionals, right, before they release it out to the wild. So that's kind of what we're seeing in our space. But yeah, so more to come on that.
Yeah, I will say there's nothing like the human touch. An AI or any robot cannot replace the human touch. There's nothing like being there when somebody's crying and holding their hand and touching their shoulder. There's nothing like, encouraging somebody who's lost 20 pounds and now their blood sugar has gone down. There's nothing like that that I don't think Chat GPT or AI or anything like that will be able to replace. So the human aspect of life and healthcare, I would hope that no type of technology modality would try to replace that.
Yeah, yeah. You would hope, they're going to try, but we saw it during the COVID. There was a big push for telehealth, which is great and it's still useful. But it had to be, and so because we just couldn't see patients face to face, so we saw growth 1,000%. But if you look at the data now, that growth has decreased significantly, right? Because people still want that human touch, right? Yes, there's some usefulness for it, but for the most part, they're getting back to pre-COVID levels of what, telehealth use, because ultimately patients want to see the doctor and have conversations. And then what we're doing is also just providing more data to the doctor, right? So they can make faster decisions. So if the blood pressure is changing, has increased, above the recommended American Medical Association or Heart Association recommendations, then you can, create, change to their medication, near real time. So things like that can help, a little bit faster, but it doesn't replace the physician, in our opinion. So, no, this has been a great conversation. Wow, where can people find you, and what's your next opportunity, speaking engagement, or anything that you're doing out there with your work?
Well, I'll keep that a secret. I like surprises, so I'll keep that a secret. But individuals can find me on LinkedIn under my name, Akuya Ampadu, AKUA, last name Ampadu. They can also find me on Instagram, Dr. Cookie, DoctorKukie. It's a cute nickname that has just stuck with me. And yeah, that's where they can find me and engage with me and hear more talk about corporate wellness and just life and holistic wellness and just trying to improve ourselves day to day for our loved ones and for our family and for ourselves.
Absolutely. Dr. Ampadu, thank you so much for your time. Please, everyone, go check out her Instagram, LinkedIn as well, where she's creating impactful messaging for those that in the corporate wellness space and just in general with her expertise. Well, everyone, thank you again for listening. I hope you enjoyed another opportunity to find out what's happening in the new space of healthcare as we all adjust to new normal. Have a great one.
Thank you. Bye.
Thank you for listening. If you like what we just talked about and you want to learn more, click either to the right or to the left, and you can find out more information about how we can help you this year.